Good evening. Thank you for joining me on my strategic plan presentation talking about Hope Alliance in the community. So Hope Alliance is a small 501c3 nonprofit center located in Round Rock, Texas. It was established in 1984. It is responsible for servicing almost 600,000 Williamson County residents. This organization's target population encompasses any individual who has been affected directly or indirectly by domestic violence or sexual assault. The only criteria to be a client of Hope Alliance is a history of domestic violence or sexual assault. So Hope Alliance's mission statement is to assist those whose lives have been affected by family and sexual violence by providing safety services and developing partnerships that lead to hope, healing, and prevention. In 2018, Hope Alliance revised its mission statement to include the word safety. This revision is seemingly small, but it elucidates a very fundamental part of working with this demographic, which is the practice of safe relationships. And safety exists in multiple forms: physical, emotional, and psychological. And Hope Alliance's intended outcome is for their clients to learn these different dimensions of safety through healing and prevention. However, um, early on in my internship, I learned that the prevention department's outreach efforts were actually pretty much at a standstill. And as an MSW student, one theme that I've taken away from this semester is to zoom out on a problem and look at it from a macro perspective. Intervention is crucial, but prevention is fundamental and essential, and it should be prioritized in ways that intervention efforts are, which is why I wanted to focus my strategic plan on improving the prevention team's outreach efforts at Hope Alliance. So internally, the prevention department is um, located under programs and services. The the problem that I want to address in my strategic plan is the lack of key community partnerships. This is this problem is evidenced by both internal and external factors. Internally, the prevention department is reliant on pretty restrictive grants that give them limited opportunities to develop prevention programs. So currently, the grants only allow them to develop programs that are to be delivered in schools and that are geared towards young female empowerment. This is an issue because of the lack of relationships that Hope Alliance has with schools. I believe this could be due to high turnover. For example, since my internship started in January, I have been there long enough to see the onboarding of a prevention department employee. Uh, I've and then the same employee leaving and then another one being hired. So I think that that could definitely be an issue with an internal issue that affects our external relationships by not being able to establish contacts, which affects relationships. And of course, COVID-19, without getting out into the community, prevention has definitely been halted. So, assessing the organizational needs and capacities, the external relationships I focused on were funding sources, referral sources, and other providers. So, Hope Alliance has multiple funding sources: government grants, fundraising, and in kind donations. Um, so, these two, and then, yeah, fundraising, and other. So Hope Alliance breaks down their two funding sources into support and revenue. As you can see, um, government funding contributions and in-kind donations fall under the support category. And this category actually makes up 94% of Hope Alliance's total funding. And within that category, government funding actually makes up 56%. So government funding is a majority of Hope Alliance's revenue. The other category includes fundraising and other incomes. This makes up only 6% of their total funding. Four critical events bring in the revenue for this this funding category. These include Amplify Austin, a 5K marathon, a golf tournament, an event called Giving Tuesday. Referral sources. So Hope Alliance works really closely with Bluebonnet Trails, Brave Alliance, which is a forensic organization. They do a lot of SANE testing, and we're just in constant contact with them. We have good relationships with Refugee Services and as well as the other crisis center in Austin, the Travis County Crisis Center Safe Alliance. There's actually a current group of women with representatives from these organizations that make up the core group. The efforts for that core group are led by the prevention specialist at Hope Alliance. So other organizations that we work with include Williamson County Police Department, other law enforcement agencies such as like the DA, and then hospitals. However, these relationships are very transactional. They're very surface level. We don't really have established relationships with them within the prevention department. So internal organizations, organization structure and leadership. Hope Alliance is is structured under a bureaucratic organization. It is hierarchical, starting with the board of directors. According to the CEO, the board of directors make all the formal decisions for Hope Alliance. The board president has the highest level of authority and is actually responsible for establishing long and short-term goals, and any decisions having to do with funding and client services. Actually, a few things that inform the board's decision making is our collection of client records. Our client database is called Osnium, so that is a very important resource that we use at Hope Alliance. Feedback or data exported from that platform really helps inform the board members' decisions. Also, the vice president of programs collects client feedback and then presents that to the board of directors, which helps them make decisions about client services. So our program and services for clients include a 24-hour hotline, counseling and case management. Counseling includes individual and group therapy. We have crisis intervention, hospital accompaniments, and courtroom accompaniments, and then a 30-bed shelter, which is actually only 20 beds due to the COVID-19 pandemic and social distancing restrictions. Policies and procedures at Hope Alliance are in place. Each paid position has a job description with responsibilities and measurable objectives. They don't have ongoing performance reviews. Um, Board minutes and bylaws are public. They are available. They make them available in multiple locations online, and then they also tell their employees exactly where they can find them. New employees are given a 32-hour orientation training. It's called an advocacy training, and it's actually really helpful. It goes over trauma-informed care, which is essential in our line of work. The history of working with domestic violence survivors was before a trauma-informed approach was an empowerment approach, but now it has moved over to a trauma-informed approach, which actually incorporates aspects of empowerment as well as psychoeducation and client determination. So it's really great that new employees are all trauma-informed care employees. Um, Cultural competency at Hope Alliance is lacking. The direct service, all of our clients are a majority of our clients are women. 84% of Hope Alliance's client population are women, as well as our employees. Actually, the only men in our organization are the CEO and the board of directors. Um, our employees are predominantly white. However, our clients are not. And every survivor deserves to see themselves reflected in their care providers. So this is something that the agency is definitely going to have to address. I believe there are current efforts to address this through employee recruitment. And this is purely anecdotal, but there are not a lot of opportunities for cultural diversity conversations at Hope Alliance. And the bilingual staff positions have the highest turnover rate. So bringing it back to my strategic plan, the goals and objectives, the overall goal is to create a community coalition that will increase Williamson County's prevention strategies. However, that is currently outside the scope of this plan. So our current goal is to build a community coalition. We have a current group, but we would like to build that out into a coalition. In order to do that, we first want to assess the current group and identify potential members. That will be done through a gap analysis. We want to make sure that our coalition is representative of the Williamson County community. So, and we want influential members in our coalition. So once we have assessed the current group, we will work towards recruitment, which involves inviting newly identified members through a recruitment campaign using face-to-face meetings, phone calls, and emails. Some barriers facing change at my agency include funding. According to the prevention specialist at Hope Alliance, state level funding is geared towards intervention services. Which explains why funding for prevention services is so restrictive. There are and why there are restrictions on what the prevention department can do to fund the coalition. The lack of funding might also require additional hours without additional pay, and it will require members to wear different hats, which is a potential lack or a potential burden. However, Hope Alliance has a really great and robust set of volunteers that they could utilize for this. Um, and then the second force against change is Williamson County is known for being conservative towards women and their prescribed roles in society. Um, so we see this a lot when accompanying women to court. And again, mentioned earlier, the Texas Office of Attorney General's um, of the Attorney General is where we get our prevention grants from, and their official recommendations for prevention services focus on empowering young girls, but they fail to include young boys in the curriculum. Therefore, it might be hard to introduce a coalition meant to make change in the community that includes both boys and girls. Shared decision making was also a force against change because of the bureaucratic structure at Hope Alliance. However, I believe that coalition and engaging in a cost benefit analysis could change this force against into uh, a force for change. Some of the other forces for change include establishing valuable relationships within the community. More relationships equates to more resources. It also, another force for change includes increasing efficacy and effectiveness for program delivery. And then, of course, creating social change by our overall impact goal, which is to increase prevention services. So, activities and timelines. The first process objective focuses on identifying coalition members by assessing the current group's membership using a coalition membership gap analysis. And this will take place over this current quarter, the second quarter of the 2021 fiscal year. Activities include assessing the strengths of the current group, and then identifying what sectors or other disciplines we would like to include in our coalition, um, assessing the current members, and then finalizing a potential member list to target. Process objective two's activities focuses around recruitment efforts for the identified potential new members. And that will take place over Q3 with an ongoing kind of open invitation tracking system. So my evaluation plan is the scope of this project is limited to identification and recruitment of key members. So I will know that my intervention is successful when there is an observable increase in membership of our coalition. Since recruitment is ongoing, we expect some people to reject our information, some people to not be consistent members. So we didn't want to give a specific number that we would reach, that we would measure our success off of. Instead, we wanted to indicate our success based off of the type of membership within our coalition, and specifically by looking at the sectoral representation in our coalition. So right now, the core group members, they're all heavily involved in the mental health field, and they are all very like-minded women. So we would really like to expand our representation um, and identify some key influential members, but we won't know what those influential members are until we complete the assessment gap. Once we do that, we will be able to identify and recruit members. um, once we have once we have some um, members who would like to join our coalition, a membership roster will be made and we will be able to observe growth. And then we will also be able to administer an adapted coalition member gap analysis, which will essentially be a questionnaire asking about members' discipline. So what background they have, what strengths they bring to the coalition, and then that questionnaire will be coded and analyzed and compared against the initial analysis, um, initial member gap analysis taken at the beginning prior to recruiting new members. So that is my presentation. And thank you for your time.